So early on, kind of in the early 2000s and 2010s, there was a lot of data in terms of what chemotherapy was best. And I pulled two studies here that essentially have opposite results in between two different types of chemotherapy, one called oxaliplatin and one called mitomycin. One showed that one was better and the other showed that the other was better. So this was something that we were trying to figure out. And we were also trying to figure out, does the Hipec for colon cancer actually add something, or is it really just the removal, kind of the cleaning up of all the visible tumor that's really helpful? And so that's what this is the kind of really the other landmark study in Hipec surgery and peritoneal surface disease was called PRODIGE-7. This was also done in Europe, and it looked at just the cytoreductive surgery, so just that first part versus cytoreductive surgery plus Hipec. And I mentioned that there was a little bit of controversy about what chemotherapy to put in the Hipec, because they chose a regimen they used oxaliplatin. And they also did somewhat of a short bath, short chemotherapy perfusion. And this show, you can see in these lines that there was actually no difference between the two. But some of the other take-home points were that this overall survival for peritoneal metastases from colon cancer was higher than some of the historical, known averages for just chemotherapy alone. So I think it highlighted that cytoreduction part is really important. And the question that it didn't answer, so I think it showed people don't really do Hipec with oxaliplatin for colorectal cancer anymore. But the question that it didn't answer is, does the mitomycin C Hipec work? So we still often will, for certain patients, use that for some patients with colorectal cancer. You can still do Hipec, but the question is kind of the drug. And so we use mitomycin C instead of oxaliplatin. But this is another kind of landmark study, I think, that showed that there's still a benefit for appropriately selected patients for this kind of surgery for peritoneal metastases.